Good evening and welcome to the second episode of Diabetes Health Matters. Diabetes Health Matters is produced by Diabetes Africa and sponsored by Eli Lilly and Company, although they had no input into the content. My name is Dr. Joan St John, and as a Black healthcare professional, I believe diabetes health matters. I'm delighted this evening that we're going to look at who is at risk of developing type 2 diabetes and how we can live happier and healthier lives with or without diabetes, type 2 diabetes. So we're going to look specifically at the risks, at the chances of what is actually called non-diabetic hyperglycemia. Bit of a mouthful, but most people know this as pre-diabetes. Now, some people feel that pre-diabetes means it's predestined. It precedes that you will inevitably develop type 2 diabetes. But tonight, what we want to show you is how that pre-diabetes can mean prevention of type 2 diabetes. We've got two fantastic guests. We've got a registered dietitian and CEO of an organization, a social entrepreneur called Shola Oladipo. Shola Oladipo is the founder and CEO of Food for Purpose and a registered dietitian. And Food for Purpose is such an exciting new initiative about eating, living, and functioning purposefully. Over the past 5 years, they've brought nutritional information right to the heart of the Black minority ethnic communities in the UK. They've worked in partnerships with local councils, health organizations, and crucially, faith groups and churches. So tonight, Shola will be sharing her insights and experience working with the Black, African, and Caribbean communities. And she's going to help us to understand how we can prevent type 2 diabetes using one of the most potent means we have at our disposal, which is our food. So thank you, Shola, for joining us. We're also joined by Samantha Banton, who is a healthcare services manager and also a very proud trade union representative. Now, Samantha was really shocked to hear that she has what we're calling tonight pre-diabetes. So find out why she was shocked, why this came as a surprise to her, and what she's now doing about it. Because this series is all about giving you the knowledge and empowering you to make the changes that you need to do to live healthily. We can give you the information, but ultimately that motivation is going to have to come from you. And Samantha shares with us what her anchors are, what her drivers are, how she has managed to make some changes. And Shola also shares with us how you can decide to make some changes and how you can make those changes easier to accommodate. So once again, let's look forward to a fantastic evening learning together. Be active in the chat. Put your questions, put your feedback in there. I'm Dr. Joan St John, and as a Black healthcare professional, I believe diabetes health matters. Thank you. So, this is the second in our series. I'm Black, how can I avoid diabetes? So let's talk first of all about what is prediabetes or non-diabetic hyperglycemia. So it's a bit of a mouthful, as I said at the beginning. I want to share with you the way that you would know if you have prediabetes. You need to have a blood test. That blood test will need to show what your level of glucose is. Now, it may show that as a means of something called the HbA1c, which is basically your average blood glucose levels over the previous 3 months. So it's how much glucose is stuck to your red blood cells over the previous 3 months. If it's less than 42 millimoles per mole, or some people would know this is 6%, then everything's fine. If it's somewhere between 42 and 47, then this is what we're calling non-diabetic hyperglycemia or pre-diabetes. Now, sometimes in some low resource settings, it may not be possible to do the HbA1c. And in those circumstances, you would have a glucose level where you've not had anything to eat for 8 hours. And I've given the figures for that as well. So knowing your blood test result is a way to do that. So we're going to have a quiz as we did last time. So get active, get your fingers ready and start to get ready to vote. So first of all, we're going to talk about the things that we cannot change. We're talking about pre-diabetes. We're trying to prevent it. Here we go. So our first question, Black people are more likely to have type 2 diabetes compared to the white community. Is that true? Is that false? Or perhaps at this stage you don't know. So can you vote now? Are Black people more likely to have type 2 diabetes than the white population? True, false, or maybe you don't know? Well, it's true, as 83% of the participants tonight are saying. It is true, our race, our ethnicity makes us more at risk of developing type 2 diabetes. Next question. So, are other conditions, will that make it more likely that you could then go on and develop type 2 diabetes? We know within our communities, let's take, for example, hypertension, high blood pressure. That's a very common condition. Is that going to make it more likely for you to develop type 2 diabetes? True, false, or maybe at this stage you don't know? Get ready and vote, and we'll see. It is true. So things like hypertension do put you more at risk of developing type 2 diabetes. And that's why it's important, if you are living with that condition, with high blood pressure, thyroid disease, polycystic ovaries, you need to have a blood test to see if you have developed pre-diabetes or non-diabetic hypoglycemia. So it is true. And third thing we want to ask you, do you feel generally unwell if you have pre-diabetes? So if you have developed pre-diabetes, are you going to feel generally unwell? Is that true? Is that false? Or perhaps at this stage again, you don't know. What do you think? We know with diabetes, you can feel really unwell. You can feel really tired. You can feel thirsty or passing a lot of urine. It is false. It is false. And 63% have said it's false. They've got the correct answer. But actually, a third of our participants tonight feel that it might be true. Well, actually, when you have prediabetes, you don't necessarily feel unwell. You'll hear a bit more about that later. I'm very pleased to introduce Samantha Banton, Healthcare Services Manager and proud trade union representative who's worked in the NHS for many years. And thank you very much, Sam, for coming to join us this evening and for sharing your experience of something that is known as non-diabetic hypoglycemia, but for most people will know it as pre-diabetes. So Sam, we've had a few myths there and a few facts. Was there anything that surprised you or that you can connect with from those things? Like, for instance, some people feel that if you were going to have pre-diabetes, you might feel unwell. What was your experience?
I felt perfectly normal. I didn't feel anything different at all.
Can you say a little bit then about how you came to know that you were at risk of developing type 2 diabetes? What actually happened?
Well, I had just recently changed my GP, was doing just my, my introductory checks, and had to do my weight and get my blood done, do my urines, and got this text to say I needed to have a one-to-one. So I didn't think anything about it. I knew that I was a little overweight, but I didn't think anything about it. And then the senior nurse at the practice, told me, and I was so shocked because as I said, I didn't feel any different. I thought I was a little overweight, but didn't worry about it. But yes, was very shocked that I was pre-diabetic.
So it came as a big shock and a surprise to you. So can I ask a few questions? Is that okay? So, I
That's
mean, is anybody in your family living with type 2 diabetes?
nobody, nobody.
So you didn't have any idea from your family history that you might be at risk of developing type 2 diabetes in the future?
No, no, not at all.
And had anybody ever mentioned that being a little bit overweight, as you put it, was a risk factor, something that could increase your chances of developing type 2 diabetes?
Well, I thought that my weight may be, but I thought to myself, because it wasn't in the family history, that I was perfectly fine. And I thought that I was managing, like food and the types of foods I was eating, perfectly well. So I didn't feel unwell, and yeah, I was really shocked. It's a piece of the information that like I had never known before.
It was something that was unexpected to
Very
you. Yeah. And you said that you felt perfectly well and the same as you'd done the day before you knew this information. So you had, I mean, looking back now, did you notice anything that was different? You said that you put on more weight, but in the way you were feeling, if you look back, was there anything different?
Um, I think I I I was more tired than I usually was, and I wasn't sleeping as well as I was. I put that down at the time to the menopause.
Mhm.
So rather than get it checked out, I just started assuming this is the menopause. I'm feeling like this, and especially when I spoke to, other women that I know in my life, at the same age as me, that some of the symptoms I was having, I was putting down to the menopause, rather than connecting it to something else.
Yeah.
So that was the other thing, is that there was a number of things I didn't go and check those things out. I just had made a lot of assumptions.
And I think that you bring out a really important point because I think sometimes there can be really subtle changes which you can put down to other things. And it's not, in terms of what we call in pre-diabetes, a dramatic change, but it's just sort of subtle changes in your body and in your system and the way you feel. And put that together with things like measuring your body mass index or your weight and your height, and certainly getting that blood test done that can make you know that you are at risk of developing type 2 diabetes. Speaking about a blood test, have you ever had a blood test for your blood glucose before?
Yes, I had, a few years ago, when I did my, just my yearly check, and it had always, my BMI was always at a good level, and it always came back as normal. So I didn't think anything about taking my bloods this time. I was expecting that it would come back and it would say that, like I was menopausal, and that, that the surgery could actually support me in that. So when they actually said to me that my BMI is over the limit that they would expect it to be, that I am overweight for my height, and that like they they've done my bloods and I'm pre-diabetic. I think like it was a double whammy for me. It was a shock because I wasn't expecting any of it, and I think that that's one of the things, is that uh, I was just assuming that everything was fine and I was a little tired, and that it was something that I could just manage if I could just change my lifestyle a bit. But I think it was quite a wake up call for me.
Yeah. And in terms of the blood test, you said that you're having your routine check. So I'm going to make an assumption, I'm not going to ask you the question, that you might have other conditions. I know that some people have things like high blood pressure, and that would mean that they have a check every year.
Yes.
So I think as part of those blood tests, a blood glucose is normally done. But
Yes.
for other people, and this is something that we've brought out in the myths quiz that we've just done, if you're from the Black community, if you're from a South Asian community, actually specifically looking at the blood tests to see if the blood glucose levels are normal or raised should happen over the age of 40, certainly, even if you haven't got one of those conditions. So even if you haven't got high blood pressure, were you having your regular blood tests then?
Well, to be honest, that's one of the reasons why I left my surgery, because I've been hypertensive for years, and I didn't think my last, my last GP was managing that. I was the one that was actually urging them every year to do something, and I think before COVID, I didn't have any test whatsoever, so I chose to just change my GP, so that those things could be routinely done. And I'm glad I did, because it's definitely changing my life, because I had that test, I had the conversation, and I now am on a program to manage everything.
So thank you very much, Sam. That was brilliant. We've talked about the things you can't change, so your age, your ethnicity. Let's look at the things that you can change. So here's another quiz.